Hi, I'm Wanda Holderman, CEO of Fresno Heart Surgical Hospital, and this message is to share in the accolades that the hospital has experienced this last fiscal year. Got some great news, wonderful successes, some tremendous awards that were bestowed upon the organization, and this is just a way to help celebrate those successes. I'll be referring to my notes from time to time. This is just a casual presentation. Normally I do something like this in the form of an email or on a blog, but we thought we'd try something a little bit different and video for your enjoyment. So some of the things as we look back on this last fiscal year for the hospital, lots and lots of awards that are a tribute to the staff, to the physicians that are affiliated with this organization, and so I want to offer you my personal thanks and appreciation for everything you do in that regard. This is an exceptional recognition. We were one of only 3 hospitals in the United States to receive the NRC Pickers Distinguished Award for Overall Patient Care Experience. And because of that, there's going to be a national convention in Chicago this month. We're going to send a couple of representatives from the hospital to accept that very distinguished award. So I want to applaud you in providing a very positive environment for patients to be here and receive care. For those of you who are involved with clinical outcomes and are familiar with some of the core measures that we measure on a regular basis, we ended the year all in the green with very high compliance for different measures that the federal government is looking at in regards to how we care for our patients, how timely we give medications, how we control our infection rates and various things. So all very, very high marks, which is wonderful. For those who work in the intensive care unit, we are one of only 15 California hospitals to have been recognized by the American Association of Critical Care Nurses for their Beacon Award, and that's just a tribute to outstanding critical care. So kudos to our staff in the ICU for your excellence. The Board of Trustees approved for 2 of our 3 Cath Labs to receive upgrades of equipment. The Cath Lab equipment has been in there since 2003, and they've been workhorses, but it was time that we upgraded those to the latest and greatest technology, so that's occurring as we speak. And then also something very exciting that I'll be taking to the Board of Trustees for approval tomorrow is a hybrid Cath Lab. That's where you combine the functionality of having a cath and an operating room all in one geographical location. So that's a very exciting project for the Heart Hospital. We received numerous accolades from the Health Grades, which is a rating agency that's known nationwide, and we received 5-star in our vascular services, the bariatrics, and outstanding patient experience awards. Something that will be published in October, but I'll let you know a little secret. It's kind of information that is really not publicly published until a little bit later, but this hospital will be awarded for the top 5% of the top 100 hospitals in the U.S. for interventional cardiology and 5-star for overall excellence in heart attack care and congestive heart failure. So that's a real tribute to the cardiovascular services that we provide here. We certainly are very pleased that we exceeded our financial budget indicators. We don't like to always just focus on the bottom line, but we know the saying is, no margin, no mission. So we're quite pleased that we were able to perform very satisfactorily and then be able to put that money back into the organization in regards to providing a good workplace for you as employees, be able to offer some bonuses, some market adjustments, good benefits packages, and buy needed equipment for the facility. So thank you for your part in that and helping us be financially responsible. For those of you who work directly in the patient care areas, we launched over this last year the Get Well Network, which is a tool to teach patients needed information that they are going to need to for their diagnosis, and so that they feel more comfortable with expectations for their stay. And also they have the opportunity to do on-demand programming. So that's been a major effort. We had some glitches here and there that we've worked through, but that's been a very positive thing for the facility. We opened the Advanced Diagnostic Testing Center, which is off-site across the street. It's for lab, imaging, and endoscopy, and we've well exceeded our expectations in regards to activity there, and things are very successful. So thank you to all who were involved in that. We were able to install the latest and greatest in CT scanning, the 256 slice CT scanner. So that was a very exciting project, and that's being utilized on a regular basis. Some very high-tech technology in regards to images and diagnosis, and so that was a real wonderful thing that we saw in this past fiscal year. We were able to upgrade some electrophysiology equipment in our Cath Lab to be able to diagnose heart rhythm issues and be able to offer patients an alternative to wellness there. So that was a real exciting project that we were able to do. We've upgraded some operating rooms with the latest and greatest minimally invasive surgery technology. We have been putting a lot of resources and time into training for the electronic health record change that's going to happen on October 1st. Very excited about going on to Epic. So thank you for those who have spent time in training and those who have helped be the trainers, because that's a very, very important project that will standardize healthcare information throughout a patient's stay, which, theoretically should translate to better care, better information, and more compliance to the things we need to do for quality outcomes. Just recently, you guys helped participate in an employee survey, and I thank you for doing that because your feedback is very, very important. I periodically will say no news is good news, and maybe that's not the best philosophy about things, but if we're not hearing what you're concerned about or what your needs are, then we're not able to address those. So thank you for giving feedback. We'll be getting the results of that hopefully by the end of September, and then we will, as I have done traditionally, will share that feedback with you and plans for improvement. Also, I want to thank, there were about 16 employees from the Fresno Heart Surgical Hospital that participated in a community-wide sponsored event called Decision Accelerator, where employees from all over the organization met for a couple of days and gave their ideas and feedback about how we can make this a better place for you, an employer of choice. So very exciting to hear some of the feedback. The human resources executives are working on all of that right now and putting together improvement plans for everything that you had to input on that. Also, just wanted to applaud you guys for an extremely successful fiscal year. What we do here, we absolutely can't happen without cooperation with employees and our physician partners, and so I want to just personally thank you for all your efforts in that regard and our successes. Some of the cool things that we'll be looking at as we look into this next fiscal year, which actually started on September 1st, is we're going to continue to balance the very foundational cardiovascular services and that particular product line and resources and energy we need to put there with the very successfully minimally invasive bariatric surgery program. So I'm very excited to be working with our staff and physicians on different projects and different initiatives for continued success of this hospital. And we're actually looking at a new service line of doing sleep studies here, because we know that's a very integral part to the being a comprehensive bariatric services program. So we're looking at the feasibility of that right now. We're also looking at the feasibility of robotic surgery, because we have a physician that's affiliated with this facility that's very interested in doing thoracic surgery in the most minimally invasive way. So we're looking at the feasibility of that. We're, again, looking forward to launching Epic on October 1st at 3 o'clock in the morning. So be ready to hit the floor running with that particular project. And then also the purchasing department is going to be changing to a new system called Lawson. So that's going to help with efficiency and being able to develop preference cards for our physicians and just really streamline the ordering process. So all that's going to happen on October 1st. And then the system is looking at some initiatives to just keep focusing on, so that we will continue being successful even in this new healthcare reform environment that we're launching into, that officially goes into effect 2014, but we're preempting that. We don't want to let it happen to us. We want to be able to guide our journey in that. And so some things we're looking at is, obviously we need to look at cost management and resource utilization, because we know our reimbursement is only going to be less as we go into the future. So we have to really be smart about providing outstanding care. Of course, we always want to keep quality at a very high position in our efforts for good patient outcomes. Of course, electronic health record is going to be a major initiative over this next year, especially for this hospital. Our sister facilities, Regional Medical Center and Clovis, converted to Epic last year. So now we're converting from Meditech to Epic. So that'll be a transition for us, but a very important one. And of course, we want to stay focused on employer of choice initiatives to make sure that you have good job satisfaction, that you're excited about coming and being here every day and providing the wonderful skill and all the things that you do to create good outcomes. And then, of course, we want to continue to build the Get Well network and add additional functionality to that. So fiscal year 12, awesome, great success. I anticipate the same for fiscal year 13. And again, just wanted to personally say thanks, and it's going to be a great year. Thank you.